Good afternoon, everyone, and welcome to today's webinar, A Sense of Balance, presented by the Foundation for Peripheral Neuropathy. Thank you so much for joining us today. Before we begin, a few housekeeping items I'd like to raise to make your viewing experience more enjoyable. This presentation will last about 1 hour and will be recorded and shared with you in the next couple of days. The recording will also live permanently on the Foundation for Peripheral Neuropathy's website, should you wish to rewatch it. During today's session, please feel free to submit any questions pertaining to the topic of balance in the chat box within this platform. We will try our best to answer as many questions as we are able to at the end of the presentation, and we ask that you only submit questions that are about this webinar topic. Should you want to ask us something else, we are available anytime, and you can reach us at 847-883-9942. or via email at info@tffpn.org. Lastly, if you are experiencing any problems with the audio through your computer during today's webinar, there is a telephone number that you can use. Just check your registration email for the dial-in instructions. I am Lindsay Colbert. I'm the Foundation for Peripheral Neuropathy's Executive Director. Again, thank you so much for joining us today and for being a part of our community. I'm joined with my colleague Nancy Froman, the Foundation's Director of Development and Marketing. Today's webinar will feature our two experts, Lars Oddsson and Laura Jacobs. Lars is a scientist and professor. He is also co-founder and Chief Technology Officer of RxFunction Incorporated. He's also co-inventor of Walkasins, an RxFunction product to help patients with challenges with balance due to peripheral neuropathy. Laura is a clinical service specialist for RxFunction and is also a board-certified clinical specialist in neurological physical therapy. And now I'm pleased to pass the microphone to Laura, who will begin today's session, A Sense of Balance. Laura?
Thank you, Lindsay. I'm really excited to be participating in today's session with Lars Oddsson to talk about how our bodies maintain balance. So the title of this presentation is A Sense of Balance, and this is a very interesting topic for me, one that piques my interest due to the complexities of our nervous system. So today in particular, we're going to talk about balance, the different sensations received by the brain, and how these sensations relate to our overall balance during both standing and walking. Specifically, we will cover how does the body maintain balance, what is peripheral neuropathy, and how does it relate to falling, and then review some of the science behind how we know what we know about balance. Lastly, we'll talk about a new balance solution. So we've all probably heard a little bit or learned a little bit about how the body maintains balance, whether it's something we learned in school or something we researched online because we may have balance difficulties. And the more I learn about balance, the more I am amazed and reminded just how sophisticated the process and the nervous system truly is. So I want to start with this picture here, which is on the slide and provides an overview of how the body maintains balance. So in the top left corner of the illustration, we have sensory receptors. And these sensory receptors capture information through various systems in the body. This sensory input is then sent to the brain and the spinal cord, which is sort of the command center. And our brain then takes that sensory information, processes it, and interprets it to understand where our body is relative to the environment around us. So our brain knows how we're positioned and then turns on relevant muscles to help us maintain or move our bodies in a way to maintain our balance and stay upright. So sensory information coming in, processing and planning by the brain, and then movement by the body accordingly to maintain stability. So while this is a very complicated process, this picture hopefully helps to break it down to help you understand how the body achieves the task of staying upright. So for the purposes of today's presentation, as indicated by the title, we're going to primarily focus on describing the multiple sensory inputs that the body relies on to maintain balance. So these sensory inputs include the visual system, the vestibular system, and the somatosensory system. And I'm going to go through each of these systems in a little bit more detail. I'm going to first start by talking about the visual system. So our visual system is located in our eyes, and we collect information from our surroundings based on what we see. This includes things such as our visual acuity, which is how clearly we see the environment around us. It includes our visual contrast, which is the ability to determine differences in colors and distinguish between objects, as well as our depth perception, so how far, how close an object may be. And these qualities or characteristics of our vision help us to navigate around our environment safely, such as when we're walking in our house and there may be clutter in our pathway, or when we're walking up to a curb and we're judging how high we have to lift our leg to step up and over the curb so that our toes don't catch on the curb. But in addition to those characteristics, our visual system also provides cues relative to vertical, and these cues help us to maintain upright. So examples include door frames, pillars, columns, windows, or other objects in our surroundings that give us clues regarding what is upright or vertical and what is horizontal. So a great example of this would be if you've ever been in a haunted house where they have this platform that you're supposed to walk across, and the platform is level and there's a door at the other side you're trying to reach. And as you walk across the platform, there's this big cylinder that has lights spinning in one direction around you. And even though the pathway is flat and the body's not moving necessarily, because the lights are spinning, it gives the individual the illusion or the impression that they're falling to the side that the lights are spinning. And one tip or strategy to help safely walk across the platform is to actually close your eyes, because then the brain is no longer receiving that inaccurate or misleading information that we're falling to one side, like the lights are suggesting. So to summarize the visual system, the system provides information for navigating our environment and also gives us orientation to what is considered vertical. And while there are many aspects of our vision that help with our balance, unfortunately, it's not something we always fully appreciate or understand until we have difficulty with our vision in some way. The next system to talk about is the vestibular system. So this vestibular system is a sensory organ located in our inner ear, and we have one on each side. So we have one in our left inner ear and one in our right inner ear. And the inner ear provides information related to how our head is oriented in space relative to gravity, as well as acceleration of the body. So I want to explain each of those a little more because it can be pretty complicated. So when we turn our head left, right, up or down, side to side, our brain is receiving information that our head is moving, and this information gives us a sense of how we're oriented in space. So an example of this would be when we are laying down and transitioning to sitting up, or vice versa. We can almost feel in our body that we're going through that motion or movement, and that is because gravity has an effect on this system, and it affects the system as we're going through that motion. As I mentioned, the system also gives our brain information about acceleration of the body, meaning when the body is speeding up or slowing down. So examples of this would include if you've been riding in a car and the car speeds up or slows down. Again, you can almost feel that in the body. Or similarly, if you're riding in an elevator and the elevator starts to go up or down, and you can again feel that. Sometimes you feel it in your stomach. But that motion is detected by the vestibular system. And again, to summarize the vestibular system, it's providing valuable information to our brain to help us stay upright relative to gravity and related to the movement of our head. So that brings us to our last system, which is the somatosensory system. And the somatosensory system is a big word that encompasses several different types of sensations or feelings that we may experience in the body. This system is located throughout many tissues, including our skin, our muscles, our tendons, and ligaments. And because this system is so widespread and located in many areas of the body, it provides a lot of different information to the brain. So what type of information is conveyed through the system? Well, this would include things like light touch, such as when your t-shirt is rubbing against your skin, deep pressure, like the pressure we feel under our feet when we transition from sitting to standing, and also vibration and temperature. Particularly as it relates to balance, the pressure under our feet has been found to be very important. So the pressure we feel under our feet relates to balance by telling our brain when our body is swaying from side to side or front to back, as well as when our feet are in contact with the ground. And I want to explain this a little bit more using these pictures, both in a standing and a walking situation. So in a standing situation, when we lean or sway in different directions, the pressure increases under our feet. And when the pressure increases under our feet, we know our body is swaying, just like the seagull in the picture who's standing on that beam. So he's leaning to his left and losing his balance. And one way he knows that he's losing his balance is that there's more pressure on the outside of his foot there. When we think about walking and the pressure underneath our feet during walking, it's somewhat of a familiar pattern with each step that we take. And in the picture in the bottom right of the screen, we see a distribution of pressure under the foot as the person walks, which is indicated by the red in the footprint icon there. So typically we start each step by making contact with the ground at our heel, and there's more pressure underneath the back part of our foot. Then as we continue walking forward and stand on that leg, the pressure increases under the middle portion of the foot and the front portion of the foot until eventually the foot leaves the ground. So when our foot hits the ground, the brain gets confirmation that our foot is in contact with the ground. And then when the foot leaves the ground, the brain gets information that the foot is no longer on the ground. So the pressure under our feet is very important for and helpful for the timing of which we take steps and for shifting our weight from left to right with each step that we take. So as I mentioned, there's a lot of information collected by this somatosensory system. And research shows that when we are standing on a stable ground with our eyes open, our brain relies most on this somatosensory system to help us maintain our balance. So again, it's a complex system, but I hope that that description helps you better understand specifically how foot pressure helps with our balance. So now I want to transition and talk a little bit about a condition that impacts one of these sensory systems and therefore results in balance challenges. Specifically, I want to talk about peripheral neuropathy, which is a condition that impacts the somatosensory system that I just spoke about. So what is peripheral neuropathy? Well, there are a lot of different kinds of peripheral neuropathy, but today I'm going to describe sort of the classic or typical presentation. And this is a condition that impacts or causes damage to the peripheral nerves of the body. And the peripheral nerves communicate messages from the body to the brain and the spinal cord. And with this condition, these messages are interrupted. And one of the early symptoms that patients often experience is a loss of sensation or loss of feeling in the feet and sometimes the hands as well. There are over 20 million Americans that have some form of peripheral neuropathy, and the prevalence or the rate increases as people get older. So the older someone is, the more likely they are to have symptoms of peripheral neuropathy. Many individuals who have this condition have peripheral neuropathy as a result of diabetes, with diabetes accounting for about 60% of the cases. And other causes for peripheral neuropathy include unknown reasons, which is called idiopathic, chemotherapy treatment for cancer, as well as HIV/AIDS. And that leaves us with about 5%, which would account for other causes, including vitamin deficiencies, as well as exposure to toxins, such as Agent Orange in the veteran population. So typically, this condition presents with changes in feeling or sensation as the early signs, which start in the feet and progress up the legs to the ankles, all the way up to the knee, depending on how far along the condition is and how much it's progressed. Eventually, the condition may affect the hands too. So this presentation often affects the left and right side equally and is called a stocking glove pattern because of the distribution of the sensory changes. So if you imagine putting on a sock on your foot, you start at the tips of the toes and slowly pull it up over the foot to the ankle. And the symptoms follow a very similar progression in that way. So when peripheral neuropathy impacts the ability to feel the bottom of our feet, it can cause severe challenges for maintaining our balance. And as I mentioned before, the sensation in our feet helps with our balance. So oftentimes these patients experience less confidence in their balance and may have a history of falls. And there's actually a lot of research that has been completed specifically looking at peripheral neuropathy and the risk of falling. Research shows that individuals who have a diagnosis of peripheral neuropathy fall more often than those who don't have a diagnosis. And when they do fall, they're at a higher risk for injury, unfortunately. And older adults who are fearful of falling, they are known to reduce their social activities go out in the community less, and maybe more socially isolated as a result. Additionally, there is a huge economic cost or financial cost for the healthcare system, as much as $50 billion a year, attributed to fall-related injuries for all causes of falls, so not just related to peripheral neuropathy. So while there are many causes of falls, again, peripheral neuropathy is a known risk factor for falls, and there's a lot of research to support that link to falls. So we want to take just a brief moment here to ask a few poll questions. So we're going to ask you, participants, if you don't mind, to answer these questions, which include, do you have numbness in your feet? And do you have difficulty with your balance? So we'll give you a moment here to answer those questions, and then we'll discuss them. All right, so we can take a look at those results here. And it looks like the first question, do you have numbness in your feet? About 93% report yes, that they do. And that is very consistent with a research study that was published early last year. And it was actually the same percentage, about 93% of individuals with peripheral neuropathy do report numbness in the feet. And that can be tested in the clinic in terms of the severity of that as it may progress. Great, and then we'll look at the next question. And we'll look at the results for that question. About 91% report difficulty with their balance in this group. And so unfortunately, like we talked about, that is a very common symptom or outcome of having peripheral neuropathy. Thank you for answering those poll questions. I just want to wrap up with a couple more slides here. So our discussion so far illustrates the importance of foot pressure sensation in maintaining our balance. And with peripheral neuropathy, there is damage to the somatosensory system, which, as we discussed, plays a role in our ability to maintain our balance. And with this condition, we have decreased sensation in our feet, resulting in decreased ability to detect body sway. The brain then receives less information related to our balance and stability, and often results in poor gait or walking, and increases the risk for falls, which may result in an injury. And unfortunately, falls are a common and frequent problem that many people with peripheral neuropathy face. And the fear of falling or a history of falling is something that is important to share with your healthcare providers so that they can help better manage your mobility in a safe way. So lastly, I want to talk about balance assessments, which are often used in the clinic by healthcare providers to look at balance in an objective manner. So these balance assessments can be completed with a patient in the clinic by performing various tasks. And these assessments are used by providers to assess fall risk, to track improvements with balance, and create goals. And most often this is completed by a physical therapist. They're usually the ones to complete a more thorough balance assessment and recommend interventions or training. And some of these assessments look at standing balance, some look at balance while walking, and they may even look at a patient's ability to use the various sensory systems for maintaining balance that we discussed. So these assessments are helpful to direct treatment and influence recommendations for fall prevention strategies that are frequently implemented by the healthcare team to help keep patients safe with their mobility. Common interventions that might improve balance and reduce the risk of falls include the use of assistive devices such as a cane or walker, home modifications to improve safety, navigating in the environment, such as removing tripping hazards like rugs, as well as exercise recommendations for strength and balance training. And patients may be referred to other providers that are specific to further address those risk factors for falls. Again, falls are a challenge and challenging area to address because oftentimes there are multiple factors that are influencing an individual's balance. So now that I've provided a background on how our body maintains balance and an introduction to balance assessments and interventions, I'm going to turn it over to Lars Oddsson to share some of the science behind what we know about balance.
Okay, thank you so much, Laura, for that great overview of how the balance system works. And hello, everyone. I noticed we are 344 logged on here listening to this presentation. We're very grateful for your interest here. So how do we know? I'm trying to help just address the question. How do we know everything about balance, that some of the things Laura referred to? And as my background is in research, in neurosciences in general, but particularly how the brain controls balance. So I want to give you a brief overview of what happens in research labs about the question of how we know what we know about balance. So for that, we require in the lab some tools to be able to measure various things and then pose specific questions that we try to understand and answer in the research area. And a couple of examples here, there's many more types of tools that are out there. I just want to share some of them. And one is called electromyography, or EMG. That's a small little sensor that you place on the skin over a muscle, and then we can measure when the muscle is active. And when the muscle is active is an indication of the brain telling that muscle to become activated for a certain task that the person is doing. So that's one important tool. Another one is called force plates, and the picture below you can see the blue plate, an example of one of those. That's something that is very commonly used in research labs of this nature as well, both for gait and walking analysis as well as balance. And it measures ground reaction forces. It's sort of like a sophisticated bathroom scale. You stand on it and it measures how much force you apply to it. And also when you sway and move on it, it can measure how you are swaying. And that's very important to be able to measure that in the research lab. Then we have motion capture systems. And that could be based on video, or it could be based on wearing sensors that detect motion. Almost like what Laura mentioned in the inner ear, we have the vestibular system, which detects motion. And now we have sensors in our phones that actually detect motion in a similar way as well. So this is technology commonly used to understand how people move during different balance activities and how it may change with various diseases. And then we also have biomechanical modeling, and that is using computers to help us better understand various complex systems such as the balance system. So you can build a model in the computer, which essentially is a number of algorithms that helps us, if you do this to the algorithm or the model, what happens? And then we can use that to validate and better understand what happens in reality as well. On the following slides, I'll begin to share some examples of research studies that have used these tools. And we can ask this question, what does balance look like? So next slide, we can see an example of a measure from one of these force platforms. And on the left, you see what we call a stabilogram, and 2 feet, someone is standing on the force plate, and the squiggle in the middle there is how you are essentially balancing in real time over a period of 30 seconds. This is called the center of pressure. And think of it almost like you're trying to balance a broomstick in your hand. And to be able to do that, you have to move the broomstick back and forth to keep it upright. And that's essentially what the brain is doing all the time when we're standing, just that we don't have to think about it because it happens completely automatically. But we can't stand dead still. We are swaying a little bit back and forth and front and back all the time, even if when we're standing still. And to the right, you see those 2 graphs with side to side and front and back, forward, backward sway, which is measured with the center of pressure. And you can see that it wobbles a little bit back and forth all the time. And it's basically showing the activity of muscles that are trying to keep us in good balance when we're standing. Another study that illustrated, coming on the next slide, is what was called light the effect of foot pressure. So if we go to the next slide, we can see the role of foot sensation for balance control. And this is work that I was involved in at Boston University in my lab that I ran there for a number of years. And this was a grad student of mine, Mr. Peter Meyer, who was involved in doing this. And he was interested in balance control. And the question was, what's the role of foot sensation? We didn't really know that well at that time. So there was a gap in knowledge. So then we came up with the idea, well, let's numb the feet of healthy people and see what happens with their balance. And this just illustrates briefly what we did. On the left, you see we connected electrical or electrodes to the bottom of the feet of healthy individuals. And those electrodes had anesthetic on it. And when you turn on the current, the anesthetic will go into the skin. And the graph below, the bars show that over a period, we were able to make people numb in their feet to the level of being clinically defined as having peripheral neuropathy for a period of time. And then it went away. And in that time, we could test the balance and see what happened. And on the right, you can see where we also injected anesthesia at the bottom of the feet in a number of subjects, and then tested their balance with numb feet. And what we learned is that body sway changes, like I showed you on the previous slide. We see that balance corrections are delayed, so they are slower. So if you trip and slip, you have a slower reaction, which of course then together would increase the risk of falls. And this is something that then we published in the literature, and it helped us overall understand better and better how the balance system works. On the next slide, we will see another study by another group that demonstrated the importance of what's called light touch. And you see this person on the left standing again on a force platform that can measure how they sway back and forth. And they were allowed to touch a support next to them, which could measure how hard they touched it. And they were only allowed to touch it with 1 Newton of force, which essentially corresponds to about 3 ounces of force. So it's a very light touch. And they were able to show that this light touch was actually more stabilizing than vision. And that's illustrated by the bars on the right and the red arrows. So they were tested standing with eyes open and eyes closed, either with no contact at all, or with the light touch condition, or with force touch, which was allowing them to hold on like a handle on the support. And that was no better than light touch. So what Laura talked about, the somatosensory system and all the information from all the sensors throughout the body, they communicate to the brain. And in this case, the brain learns that this light touch point is an anchor point in the environment. And every muscle from the fingertip through the shoulders, through the arms and up to the body will then be activated in the best way possible to stabilize the body. So it's a very sophisticated kind of control that occurs in this fairly simple circumstance. Another interesting study is shown on the next slide, and that's the concept of context specific. And it sounds complicated, but it's fairly straightforward. If you see the person on the little straw man there, he is not holding on, but he's standing on a platform, or like the rug is being pulled away from him. So it's an arrow pulling him backwards, so he will begin to fall forward. And you can see EMG, electromyography below, from muscles, the biceps, which is in the arm, and from the hamstrings and the gastrocnemius, which are muscles on the back of the leg, and they're highlighted with black dots essentially on the person there. And those muscles turn on very quickly to help propel the body back to balance from the unbalanced situation of having the floor being pulled away from you. So those are the best muscles that brain has access to in that situation, in that context. On the right, the same person is standing, but is holding on to a handle. And then you can see that doing the same thing, suddenly it changes to activating the biceps muscle instead of the leg muscles, because then suddenly that's the best muscle that can be used to stabilize. So this is something that shows the sophistication of the brain's control of balance. It happens very, very quickly, quicker than your voluntary reaction time. And it's something that is a very sophisticated way that the brain knows where the stability is in the environment and uses that to control balance to the best of their possibility. The next slide shows what happens during walking. And here, I'm not going to go through in deep details here, but when you walk, the brain figures out all the time where to place the next step so that you continue to be in balance. And you can imagine that if you put your foot too narrowly, you will be out of balance and you may risk falling to the side. And this is very important for your balance during walking. So here is an example of a study we did where the person was walking and suddenly we pulled away the rug underneath the foot so that you would induce a small fall, not to the point where the person fell, but sort of like stepping onto a little patch of ice. And it may be a 2-inch patch of ice. So you would then stop immediately after 2 inches. And it shows the correction that the brain addressed with the next step. And very, very quickly, if you slip to the right with your right foot, the brain tells the next step to become wider so that you can minimize the risk of falling. And this is something that requires and assumes an intact functional balance system that Laura talked about. So various problems in the balance system, for example, peripheral neuropathy, for example, patients who may have vestibular problems in the inner ear and other balance problems may then be at a higher risk of falling in these kinds of circumstances. On the next slide, we illustrate how you can train your balance, because you can. Like Laura mentioned, physical therapists can do this. And here's a study we did, and you see a little video moving here on the top left of those figures on various stages of difficulty in a progressive training program that was implemented. Because there's some very important principles you need to adhere to make sure that balance training works. And this is something that the expert physical therapists understand and know about. And those principles include specificity, meaning that you need to train what you need to improve. And here you see we actually train people in responding to perturbations. They're pushing each other here back and forth, and they're getting sort of a little bit of unexpected perturbation and learn to quickly react to those. It also has to be progressive so that you make it more challenging over time. If you sort of learn to do 5 push-ups, then you have to practice more than 5 push-ups to get to 10 push-ups and so on. You have to be progressive in your training, and it has to be functional as well. So here you can see also when they're walking across those flat discs on the floor, they're unstable. So those discs induce some small slips and uncertainty and instability, and you train to react to that in a very functional manner. And the lower right just shows the effects of that training study, where the control group didn't change anything before or after, but the experimental group with the red star, they actually showed a change in this parameter that we measured, which essentially told us that they became more sensitive in their corrections to balance. And that's something that is important to know when you enter balance training, that it is specific, progressive, and functional. And we're now coming to a couple of more poll questions here that we want to share with you. And here are the 2 questions, and we're going to enter those here now. Have you fallen? And have you had balance training or physical therapy for your balance? Okay, thank you for answering those. So about 2/3 have experienced a fall. And that is not unlike what we see in a current ongoing study we actually have called Walk to Wellness, where patients are part of this study, and some of them have fallen in the past and some of them have not. And this is in that range. So thank you for answering that. Okay, so about 50-50 of you have had balance training or physical therapy for your balance. It is important to know that the right kind of balance training helps. It does work. Studies have shown that. It is also something that needs to be maintained over time. So it's sort of use it or lose it, or whatever you want to call that. But it's absolutely true that balance training can help to improve balance and function. So overall, just summarizing on the research study, that the researchers across the world are coming up with very smart questions and trying to answer them in the lab. And this was just a small sample of studies in that area, and there are thousands of studies out there that every day helps us understand more and more and improve both outcomes and understanding of balance problems. So in conclusion here, Laura is going to take over and conclude this presentation. Thank you.
Thank you, Lars, for that background on some of the research and introducing aspects of balance training that can be completed to help improve balance. So like Lars mentioned, we want to conclude our time together by recapping some of the information that was covered. First, our brain uses sensory information to help us understand where the body is in space and our environment and to maintain our balance. And these sensory systems include our visual system, our inner ear, and the sensation or feeling in the bottom of our feet and legs and other places in our body. With a diagnosis of peripheral neuropathy, there's a reduced sensation in the feet, which increases the risk of falls for individuals. And healthcare providers, specifically physical therapists, can help complete balance assessments and provide training and intervention recommendations for the patient to reduce the risk of falls and improve the safety with mobility. Before we close today, we wanted to present a new balance solution for individuals with peripheral neuropathy. This is a device called Walkasins, which is a lower limb sensory prosthesis that is designed to replace some of the lost sensory nerve function on the bottom of the feet to help improve balance. So this is a brief 4-step illustration of how the product works that I'll review with you. So first we have patient population peripheral neuropathy who has reduced sensation in the feet, which causes unsteady walking and unfortunately leads to an increased risk for falls. Walkasins is a device that's worn on the lower leg, and it includes an insert in the shoe that detects changes in pressure under the foot as the person stands and walks around. And that is connected to a unit worn around the ankle that analyzes and interprets the changes in pressure from underneath the foot. And it provides a gentle sensory signal to the lower leg. And these new sensory signals are then integrated by the brain to help replace the lost sensation in the feet and therefore help improve balance and gait as well as confidence with mobility for the individual. We have a really short video that we'd like to share, and this includes a really brief patient testimony as well as a few comments from a physical therapist who has worked with the product firsthand and worked with these patients. So we'll go ahead and play that video for you now.
Continually falling and tripping, and finally went to the doctor, and the doctor tested me and told me that I had peripheral neuropathy.
To do anything, I mean anything, didn't matter what it was, walking to the mailbox, walking through the house, walking to the car. I mean, my confidence level, it went from being confident to 0. When I first put them on, she asked me to stand up, and the vibration around my leg, it was instantly just like it was actually the real nerves in my foot that I was actually reading.
biggest challenge is there's only so far that the other systems can take over, because there are situations in which we really depend on the somatosensory system. And so in teaching these systems, we get them about as far as they can go, but we really need something to help with the somatosensation. And so that's where the Walkasins comes in. It really gives sensory substitution for that missing sensory information. And so the patients can then know where their feet are again and where their legs are in space.
So Walkasins is available for patients with peripheral neuropathy and balance difficulties. If you're interested in learning more about Walkasins, please visit our website, which is RxFunction.com, for complete information about the product, and you can feel free to contact us to discuss further. So we just wanted to take this time to thank you for attending the presentation. We wanted to thank the Foundation for Peripheral Neuropathy for allowing us the opportunity to speak with you today. And we hope that this information has been helpful to you. Thank you again.
Hi, thanks, Laura. We'll open up to questions and answers, hopefully now. One thing, perhaps, hi, I'll introduce myself quickly. I'm Nancy Froman. I'm the Director of Development and Marketing for the Foundation for Peripheral Neuropathy. Thrilled that everybody was able to join us today, and we've got some good questions coming in. We'll try to get through as many as we can. Those questions we can't get to today, we'll try to open up at another point in time. Laura, Lars, do you want to come back on and I'll ask the questions, and hopefully you've got some answers for us.
Absolutely.
Great. Maybe you can quickly talk, many people have asked about the Walkasins, if they're interested in participating in your studies or want to find out if they're right for them or if Medicare covers them or anything like that. How do they get in touch with you, or how would they find out that information?
Go ahead, Laura.
Yeah, I'd say the best way would be to visit our website. We have a contact page that we can schedule an appointment with a Walkasin specialist to further discuss the product and answer questions that they might have. You can also call into our customer service number, which is listed on the website as well. Again, the website is RxFunction.com. And again, we can connect you with the Walkasin specialist to answer those questions and further direct you to potential next steps.
Great, thank you. Many people have questions about activities or specific exercises or physical therapy that people can do to improve their balance. Can you maybe address what someone can do at home, and then maybe what somebody can ask a physical therapist to help them with?
Yeah, I can start there and you can fill in, Laura. I would recommend that anyone wanting to do exercises in the home should communicate or discuss with their physical therapist to make sure that you're doing safe activities at home. And the tricky thing to some extent with balance training is that you need to challenge balance to be able to improve, as we talked about that. And that means that you have to do it in challenge balance in a safe way. And there are ways of doing that, but it's something that you need to make sure you address and communicate with your physical therapist, preferably. There are also studies showing, for example, that Tai Chi is beneficial, and you can join, and many times you can reach those through your healthcare provider. There are healthcare systems that offer activities related to Tai Chi, but it's also commonly that the physical therapists are involved or know about those. So I would recommend that, and making sure that you understand that you need to challenge your balance, but you also have to do it in a safe way so you don't fall and injure yourself when you're doing the training. That's something we certainly want to avoid.
Do patients have to see a special kind of physical therapist for this training, or what should they ask to even make sure they're going to the right therapist?
Yeah, so a lot of physical therapists are trained in balance conditions and treating balance. Somebody who is maybe a little bit more specialized would be a physical therapist who is specialized in neurological rehabilitation, where they work with individuals who have conditions or disorders of the nervous system, such as peripheral neuropathy. And they might be a little bit more trained for it, and also may work at a clinic that has access to more tools or equipment to help them assess balance and treat balance as well.
And furthermore, if someone goes to your physical therapist and you receive balance training from that physical therapist, you should be able to feel that this challenged my balance. This was hard, but I'm doing it with little risk. But if you don't feel that challenge, it's likely not going to help you. So you should be the one that communicates with, if it's a physical therapist or some other trainer, that I need to challenge my balance, but I want to do it safely. But if you train exercises that don't challenge your balance at all, like you just sit in your chair and do leg extensions or rubber bands or something, that's not going to help your balance. So you need to, in your own mind, feel that this is kind of hard, is a little bit challenging, but that's the sweet spot you want to be in to notice improvement over time.
And that's, I think, exactly the role of the physical therapist. As Lars mentioned, there are certain principles of training to help improve balance, specificity, and there's a progression to it, and it's challenging and it's functional. And so the physical therapist can really help tailor that to the individual to make it most effective.
Okay. And in part of that training, is it always training the feet, or is the training the inner ear or the vision? Is there other training that can be helpful as well?
Yes, a good therapist will be able to address and target specific exercises that are sort of for that category of patients. So patients who have vestibular balance problems may not do exactly the same activities and exercises as someone with peripheral neuropathy. And there is some overlap, that there are activities that would benefit both, but there is sort of a specialty or specific activities that are targeted towards the needs of the patient, and that's very important as well.
Great. We had a couple of people who said that when they're moving, their balance is okay, but standing still or going through narrow places slowly is actually more difficult. Is that typical, and what should somebody do about that?
Yeah, I think that everyone has different activities or things that they complete during the day that's more challenging for them, and it's not uncommon that standing activities are more challenging for someone than when they're walking or moving. Sometimes when we're walking or moving, we can use momentum a little bit to help us with our balance, like riding a bike. It's easier to ride it a little bit faster than it is to ride it really slowly. And so again, based on the individual, they might have challenges or difficulties based on the situation or the activity that they're completing. And again, that's where the physical therapist can come in to help tailor activities specifically towards the activities that are challenging for the individual.
Great. Do you have any specific recommendations for people getting up and down stairs?
Hold on or take the elevator.
Yeah, use a handrail if there's one available. Sometimes people use canes or assistive devices in some way. But again, for specific recommendations for their scenario, I'd recommend talking to their healthcare provider or physical therapist in some way, or like Lars mentioned, use the elevator if there's one accessible.
Right. Lars, somebody specifically asked in your presentation, you referred to sway. Is that something that's common only with patients with peripheral neuropathy, or do all people have a bit of sway when they stand and walk and it's just maintained differently?
Yeah, thank you for that question. Sorry, I didn't clarify that, but everyone sways. And it's even so that someone with a healthy, completely younger sensory system may sway more. Whereas when you begin to have balance problems, the person may sort of stiffen up and try to balance by just stiffening up and be more like a rod. And that kind of works until you fall, but then you fall like a rod, and that's not a good thing to do. Whereas, so everyone sways. It's normal to move around and have that little spaghetti wiggle that I showed there. And then there are different characteristics in that we can measure in research and also sometimes in clinic to see that there's a signature of sway that is different for different patient categories. But it's true that everyone sways. Nobody can stand dead still, even if they try.
Right. The can does the numbness or the lack of balance, does it vary over time? Can it get worse? Can it get better? Or what do you suggest that people just deal with the situation they're in now? Or what do you suggest for patients?
Yeah, so peripheral neuropathy is a progressive condition. Typically, as it progresses, the numbness or the sensory loss gets worse. So there's a greater degree of loss of sensation. Additionally, as it progresses, it usually moves further up the leg. So it might start where they have numbness or tingling in the toes, and then maybe the whole bottom of the foot. Maybe it goes up to the ankle. Over time, it generally does travel up the leg to the knee. And typically when it gets to about the level of the knee, they have more sensory loss in their hands. So it does progress. It is a progressive condition. And again, that degree of sensory loss will get worse. And then as far as what to do about it, the earlier that you can try to work on your balance, or as soon as you start to notice that something might not be as good as it used to be, whether that's your walking or your balance or other things, it's important to try to address that sooner than later, to try to be more preventative, to maintain your mobility as long as possible, typically.
And we can also add that depending on the underlying cause of the neuropathy, for example, diabetic peripheral neuropathy, it is progressive, but you can have some degree of control of that with healthy lifestyle and eating and medication and so on. And that's commonly managed by a physician or that you're in contact with. And you could also make sure that you communicate to your physician regarding balance problems. They may not always be aware of more that they know your glucose levels or H1C levels, but they may not know and associate that with the neuropathy progressing and bad balance coming in. Those two are connected. So you can maybe sort of control the progression by a healthy lifestyle and managing your glucose levels well, but then you can compensate with balance training and interventions there. That's the other way of trying to manage it. Then if the cause is chemical-induced neuropathy from chemotherapy, that's something when chemo stops, the nerves begin to grow back, but it's a very, very, very slow process. It can take years. So it depends a little bit on the underlying cause of the neuropathy as well.
Yep, absolutely.
Great, thank you. This is an interesting question. Is balance training addressing the nerves or the muscles?
Both, I would say, but balance, it's sort of training the sensory part that Laura talked about to improve how that is used to activate the muscles. So it's sort of both sides of the coin as well. And I showed a slide where we noticed that subjects became better at detecting changes in balance. So that would be that the sensory nerve side has become better. But then the brain has to use that information to better activate the motor nerve, which is the muscle side of the balance system. So it's a little bit of both. That's the sort of challenging the sensory side and then making it better on the motor side.
That's what makes it so complex, I think.
Yeah,
that's right. That's right.
Exactly. We've got a lot of questions about the Walkasins themselves. There was one gentleman who actually was in the study, and which is interesting, and he wants to know how will it be able to feel the signal produced by the Walkasins to correct the gait? Maybe you can, I know you went through that a little bit, Laura. Maybe you can give people, again, what does it feel like to wear the Walkasins? Under what conditions can it be used? And how do people know that it's good for them or not good for them?
Yeah, so I can kind of describe typically what we instruct patients to expect from the device when they first put it on. So we first have them walk so that the device can auto-calibrate to the individual walking characteristics. Then we go through a series of standing and walking activities. And in the standing activities, we have them do various things like shift their weight forward, back, side to side, and with eyes open and eyes closed. And so as the individual leans forward, they would feel a vibration or a tactile stimuli, which is in the form of vibration, around the lower leg, similar to a cell phone or pager vibration. As they lean forward, they'd feel that in the front of their leg. And then as they lean backwards and there's more weight or pressure in the back of their leg, they would feel that stimulation in the back of their leg. Same thing side to side. So the idea is that Walkasins is helping to replace some of that lost sensation by providing a new sensation in the form of this tactile stimuli, which feels like a vibration. So when standing, they would feel it in all four of those directions. And then in more of a walking situation, when the foot makes contact with the ground, typically at the heel, they receive that tactile stimuli at the back of their leg, again, giving them the sensation or information that the foot has hit the ground. And then as they continue through the stance phase of gait or standing on that leg, when the foot then leaves the ground, they feel that tactile stimuli or vibration in the front of the leg, giving them confirmation that the foot has left the ground. So as they move around throughout the day, standing, walking, doing stairs, various activities, based on what's going on underneath their feet, the individual will feel that tactile stimuli or vibration around the lower leg. And like Lars was describing, the center of pressure, the Walkasin system is essentially estimating where that center of pressure is underneath the foot, and based on movements in that center of pressure, providing that tactile stimuli to the individual.
And I would imagine that it's something that a person needs to be trained how to use or shown how to use. Is that correct?
Well, I can add that it's a little bit more complex. We're learning. So in our study called Walk to Wellness, which we're currently not enrolling new subject into because we've had it going now for about a year, and COVID has challenged some of the data collection for a number of research studies across the world. But the short story there is that some individuals, and it seems to be about half, they learn very quickly, very intuitively, within these 5-10 minutes that Laura mentioned, and they instantly walk better and stand better. Then there's a subset of individuals that maybe a third that take more time. So we see over a period of 2, 6, up to 10 weeks, they improve gradually in their balance measures. And then there's a smaller cohort that don't improve at all during that time period. And they may be individuals who maybe have other conditions or other more pain, because some patients also come with neuropathic pain. So there may be other reasons we don't fully understand yet what that is. But so some patients learn quickly, instantly, and it goes back to, I usually make this comparison with gym class. Some individuals are just good at many different sports. They're sort of coordinated and they learn quickly a new thing, and others just need more training, need more learning before that happens. So it's both sort of an unconscious improvement as well as this conscious feeling these vibrations. But it's not that every step I have to consciously think about, feel this vibration. No, you get this new sensation to the brain, and the brain learns to incorporate that on a more unconscious level when you use it more.
Great. Well, we're just about out of time. I want to give a little bit of time to wrap up. Thank you, Laura. Thank you, Lars, so much. Do you have any last words before I pass it over to Lindsay for our wrap up?
No, thank you for this great opportunity. Very exciting. And if there are more questions that we didn't get to, we'd be happy to follow up and answer them in another forum. It could be email, it could be something else.
Great.
So, thank
We've
you.
got some that we might pull together and send over to you. And a couple of people asked, you know, this is being recorded and we'll have the slides made available, and some follow-up questions. So thank you very much. And I see Lindsay there ready to go. So I appreciate all of your answers, and I appreciate all the questions that came in. Thank you so much. Bye.
Thank you.
Yes, thank you all. Thank you so much for today's session, our experts, my colleagues as well, and thank you to those who joined us live. We will be sharing a survey at the end of this webinar. We would really love your feedback if you liked it. We're hoping to do plenty of sessions like this on different topics in the future. So we value your feedback so that we can continue to improve. We also would love any support you can share with us, financial or otherwise. We are a nonprofit organization, and any help we can get will allow us to continue these types of programs for the foreseeable future. As Nancy mentioned, and I mentioned earlier, we will have a recording of this presentation, which should be ready within the next couple of days. You'll be alerted when it is, and it will live permanently on our website. It will also include the presentation slides, which I know were extremely helpful for today's session. So be on the lookout for that email. And if you have any other questions pertaining, whether it be to balance or anything else, the Foundation for Peripheral Neuropathy, we are here to help you. Feel free to reach out to us at any time, and we look forward to seeing you again. Thank you again, and have a good rest of your day. Bye-bye.